So as you've outlined, machine learning disciplines within AI have really gained um, a lot of attention, a lot of weight recently. And that's not surprising, mainly because there is a lot of data now that is at our disposal that we can use. And in general, machine learning disciplines are split into what we call supervised versus unsupervised learning. So the unsupervised learning approach is where you just ingest large amounts of data and sort of let the algorithm do its thing in learning from it. And over supervised is the opposite, right? Like you tell it what to look for, you tell it what's in the data, and then it has to learn from that. And the evolution that we've seen over the past few years is a trend that is more towards the unsupervised approach because of the two things. First is the large amounts of data that we have, as I mentioned. But then second is also evolution in the discipline of machine learning itself, where now we have just so many different algorithms that people can apply and implement. And because of tools that allow us to test all these algorithms in parallel. So like in this paper, for example, we use this approach called auto ML, so auto machine learning, where it is automatically testing many, many different algorithms on the data, and then making it easier for us to pick which one of these approaches, or, so you go usually with 5 and you rank them, the top 5 will have the best performance. So it's become easier to implement the compute, and there is more data. So that's where, in the bigger picture of machine learning, how the field has evolved.
Mhm. Well, it's very, very interesting, and to hear a lot of the different types of approaches that are kind of being implemented. We see it obviously being tested out in a lot of different clinical research settings across neurology, to say the least. So talk a little bit about some of the actual specific research. What did it encompass? And just give our audience a little bit of an overview of some of the findings and things of that sorts.
In this particular study, we leveraged the fact that we have a very well phenotyped, a very well characterized large patient cohort that went through the whole exercise of being tested for brain surgery for epilepsy, and then having the procedure, and then having a long enough follow-up afterwards so that we know if the surgery worked or not. In the world of machine learning, sample size, so the cohort itself is a very common challenge because in general, neurological conditions, particularly epilepsy, are much rarer conditions than things like heart disease or, strokes or diabetes, where it's very easy for machine learning algorithms to get thousands of patients, to build models on. In epilepsy, the disease itself is much rarer. The subgroup that ends up having brain surgery is even smaller. So it is very difficult to collect large enough samples to do good machine learning research on. In our situation, because of the history that our team has with studying epilepsy surgery and doing research on it for over a decade now, we have been able to collect the largest cohort of epilepsy surgery patients and collect all these outcomes on them. So that for us resolved the first challenge, which is the sample size issue, the having number be big enough. The second advantage of this particular research study is the type of test, the type of data input that we used, which is scalp EEG, so the routine EEG that every patient with epilepsy gets. We were very intentional in choosing that, as opposed to what is commonly used in machine learning research in epilepsy surgery, which usually is either intracranial EEG, so surgeries where electrodes go inside the brain to record. That's a much more elegant, procedure, but it is very risky for the patients. And most people who get brain surgery don't go through an intracranial evaluation. So whatever you learn from that isn't going to be generalizable or helpful for the larger cohort of patients with that disease. Or other studies have used very complex imaging algorithms. You do a very special type of MRI, and then you process it in a very special way. So again, it's a very interesting intellectual exercise, but it's not going to help people because the vast majority of patients being worked up for epilepsy aren't getting those things done to them. The attractive thing with scalp EEG is that this is the bread and butter of evaluating any patient with epilepsy anywhere. So every patient who is getting epilepsy surgery is going through that procedure. So if we can learn anything from a scalp EEG, whatever that knowledge is, it will be generalizable and helpful, to the population at large. So those two principles, us wanting to do good science, and that would require having a large enough sample size, and us wanting to do helpful science where we are looking at studying something that could be clinically translatable, those two principles really drove this study. And that's how we designed it. We took the cohort, we analyzed their scalp EEG, focusing on just a few minutes before and after seizures, and then processed the EEG in a way that allowed us to implement, the different machine learning algorithms that we were interested in, and then ended up finding that the predictive value, the information that we get just from those few minutes of EEG is right now the most accurate prediction algorithm that is out there, regardless of the modality, regardless of even algorithms that combine different modalities.